Welcome to the December 7th meeting of the Dover-Sherborn and Dover-Sherborn Regional School Committees. My name is Nancy Cordell, and I call this meeting to order at 7:05 p.m. This open meeting is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency and signed into law by Governor Baker on June 16th, 2021. Information on how to join remote school committee meetings and meeting agendas are posted on the Dover-Sherborn District website. Please note that this meeting is being recorded. Please be aware that anything you broadcast may be captured by the recording. The next part of the meeting is community comments. And before I read kind of a 2-minute protocol about community comments, I would like to just understand if we do have anyone making community comments or multiple people making community comments. Could you raise your hand if you would be making a community comment? Does anyone see anyone? I don't want to miss anyone.
I had seen someone named Susan Edney, but she took her hand down.
Okay. All right. Going once, going twice. Okay. All right. We will move on from community comments, and I will turn it over to Kathy and Beth to do the next portion of the agenda.
Thank you, Madam Chair. Good evening. Under the Superintendents Report, we're going to start with, as we had mentioned back a number of months ago, NYU, who is doing our equity audit in the district, will be doing regular updates for us. So I'm going to ask to turn that over to Assistant Superintendent Elizabeth McCoy and our team from NYU. I believe they're on Zoom with us tonight.
Thank you, Superintendent Smith. We are joined tonight by Sarah McAllister. She is our Principal Research Associate from NYU and is chairing our Equity Audit Advisory Board, which, as you know, is made up of students, teachers, community members, parents, administrators. And so Sarah is here representing that group and the work they've done to date. So Sarah, if you don't mind taking over and providing us with an update about the work so far and where we're headed.
Great, thank you so much, and thanks for having me here this evening. So tonight, I just want to share a brief update on the focus groups that we've recently conducted and are in the process of conducting, and the next steps for the equity audit. During the week of November 15th, we conducted 15 focus groups with 82 members of the Dover-Sherborn community. We spoke with students, parents and caregivers, and faculty members at each school. We had really rich conversations and got really nuanced data, which is thanks to the advisory board members whose thinking and feedback greatly improved our protocols. We have a number of focus groups that we still plan to conduct and we're working to schedule, including affinity focus groups with METCO families and students, students with IEPs, and LGBTQIA identified students. We also plan to interview families who have left the district and hold a focus group of the 4 principals. That one will happen likely after we've done some formal analysis of the data that we've already collected. We're in the process of formally coding and analyzing the focus group data, but in the meantime, I wanted to share just a few emerging themes so far. So what we heard in the focus groups a couple of weeks ago was a real acknowledgement and appreciation that this work is already underway and that changes have started. We heard about more diverse materials in classrooms, more conversations around race, gender, culture, and other lines of difference, efforts to bring family culture and holiday celebrations into the classroom, and more openness and responsiveness on the part of educators and administrators. We also heard recognition that there's room for growth and that real change will take sustained and multifaceted effort with significant investment of time and resources. And we heard across the board a real desire to learn and to access resources and supports. We heard a shared sense that the typical Dover-Sherborn student is assumed to be white, middle class or wealthy, Christian, neurotypical, high achieving and athletic, and that if you're not most of those, it can be hard to find your place here. We heard numerous stories of race, gender, disability, and religion-based bias, ranging from unintentional insensitivity through bullying. We heard some uncertainty and confusion and skepticism around how bullying and other incidents get handled, and a sense that there aren't always real consequences, and that the goal is sometimes to move past incidents quickly, and that the public responses often default to sort of general statements around respect. One parent described it as soft shoeing around hard issues. We heard widespread desire for more transparency around discipline policies and practices for handling issues, and the avenues for handling concerns on the part of parents and caregivers, more culturally responsive curriculum, and more discussion of diversity and equity in the classroom, more avenues for belonging and for being celebrated and affirmed beyond sports and academics, much more support for teachers around intervening constructively when bias incidents and bullying happen, and around revamping the curriculum and instruction. Time and space for conversation and for community building, both among students and also among and between families and educators. Space for sustained, authentic conversations about hard issues, and hiring practices that would result in more diverse faculty. We did hear some apprehensions about this work from some parents, including concerns about maintaining rigor, apprehensions about significant changes to the curriculum, and some resistance to talking openly about racism and other forms of inequity, especially with younger children. And some real bright spots that were highlighted by our participants in focus groups were challenge success, the new work around social emotional learning, and the age block and flex period. And we also heard very enthusiastic reviews of the ideas course from teachers who participated in that. Our next step is a short survey, which will go out next week to students in grades 4 and up, school staff and faculty, and parents and caregivers. It parallels the questions that we asked in the focus group, and it's a combination of multiple choice and open-ended questions, so you can share as much or as little as you like. We hope to get a really robust response to the survey. We know that the focus groups are limited just in terms of how many people can participate. And so we hope this data will complement the focus group data and help us shape the rest of our data collection. And at the next joint school committee meeting, we look forward to our advisory members sharing some more extensive findings about the focus groups in the survey. So thank you very much for having me.
Thank you, Sarah. Nancy, I don't know if there's questions, or you want to take questions from the committees or comments.
Sure. Does anyone from any of the committees have a comment or question? Colleen?
Yeah, thank you. Thank you, Sarah, for the update. It sounds like a lot of good work is being done. It's very exciting. I'm hopeful that we can communicate out these findings sort of as we go along. I'm not sure what we're prepared, how we're going forward with that, but I feel like this is really valuable information for the whole community. So I don't want to sort of wait until June or till the end of the year to sort of, use these findings. It's really valuable to us. So I'm curious how we can communicate these out.
That's a great question. We'd also, like to be sharing and getting feedback along the way. So I think we would like to complete the outstanding focus groups that we haven't had a chance to do yet. We think there's some groups that are really important to hear from. But I anticipate that in the early winter, we'd be able to share some written findings, maybe a slide deck from the focus groups, and maybe the sort of very initial analysis of the short survey that's going out this week. We will be meeting with the advisory board in early February to review those findings, and then I hope we'd be able to figure out some ways to share that with the broader community.
Okay, great. Thank you. It's great work. Thank you.
Thanks, Colleen. Anyone else? Committees. Oh, Dennis?
Thanks, Nancy. Sarah, great update. Just one question I have around how are we ensuring sort of the authenticity of the responses we're getting? Are the cohorts sort of mixed in terms of who's attending the various sessions, or are we trying to sort of target specific cohorts to try to get the sort of the depth of response that we'd hope? Could you comment on that a little bit?
Yeah, I can say the focus groups were pretty diverse in terms of race and ethnicity, role. They included parents and caregivers of students with disabilities, members of religious minorities. At the middle school and high school, we held both sort of open focus groups that were open to any student, as well as affinity focus groups for students of color. And we also, plan to do some follow-up focus groups with other affinity groups. I think there was a real diversity of experience and opinion in the focus groups that happened. And so I'm fairly confident that they're, I can't say that they're representative of every viewpoint in the district, obviously, but it felt like there were some real differences of experience and really rich conversations that happened throughout the focus groups.
Great. Yeah, the affinity groups, I think, hit on my point, just sort of making sure that people feel comfortable sort of opening up in the sessions, and it's not sort of an environment where somebody wouldn't give kind of true, honest feedback.
Yeah, thank you. Yeah, I think the affinity groups are really helpful for that. I think the affinity group for students of color, which was led by a researcher of color, that felt like, that students felt comfortable sharing, and we hope that's true for the other affinity groups as well.
Great question, Dennis. Thank you. Anyone else? No? All right. Thank you so much, Sarah. It was a great update. And thanks, Beth.
Thanks.
So, next is face coverings.
Yes, so I'd like to present a PowerPoint just to go over some figures that keep changing by the moment. I think it's important to share this with the community. So I'm going to talk this evening again, and we've been talking, I feel, for the past couple of months about our Department of Elementary and Secondary Education 80% vaccination threshold. So many of you know that as of October 15th, the department had shared that schools that demonstrate a vaccination rate of 80% or more of all students and staff in schools can submit an attestation form to DESE. You are aware that I submitted that form on behalf of Dover-Sherborn High School, which had reached close to 90% vaccination rate on October 20th, 2021. I did get the approval back on that from the department on November 15th, so actually almost a month ago. With approval, vaccinated students and staff in the high school would no longer be subject to the mask requirement pending school committee review of your current face covering policy, which you approved in August 2021, just before the start of school this year, which is requiring all students and staff in our district to have a face covering, a mask, while on school property. So going forward, also unvaccinated students would be required to continue wearing masks, even if you do modify your face covering policy and we vote to at some point unmask our high school, which again has met that 80% attestation rate. I want to make sure the community understands that all our other schools at this point, and I'll go over it very quickly, our middle school and our two elementary schools, Pine Hill and Chickering, obviously have not met that 80% vaccination rate of all students and staff. Our youngest students have just had the opportunity the past month, although I'm going to be excited to talk about that. So they have to wear face coverings at least right now through January 15th, 2022. I will also let you know that we meet with our health and hygiene advisory each week. It is very helpful in trying to move our district forward and continue to focus on our goal of keeping all our students and staff in school for in-person learning. We've been very successful this year. We will talk about some concerns we have, but at that meeting on the 10th of November, the boards of health of both Dover and Sherborn did approve the lifting of the indoor mask requirement under certain circumstances. And I also want to let you know again that we are working with our local boards of health on safe unmasking. So let me go to the next slide on unmasking metrics, as I'm calling it. And I know that this evening I do have a number of our doctors from both Dover and Sherborn that serve on the boards of health and on our health and hygiene advisory. And I will ask them to, I'll present this slide. I'm going to stop and ask them to talk about some of the factors. So what I'm saying is we're lining up some of the things we had to do. We met the 80% vaccination rate at our high school. We put in the attestation form. We have already gotten approval from the Department of Elementary and Secondary Education. Our boards of health have at their meeting also approved that when we meet certain metrics, they are recommending that we uncover or go maskless at the high school for those students and staff that are fully vaccinated. So I'm going to do my best with looking at some of these metrics. We're trying to be transparent, and we're following, for instance, CDC guidance on local positivity rate is based on 7 cases per 100,000. For safe, reasonable unmasking, the positivity rate should be below 7 cases per 100,000, which would equal the low transmission range. I understand that presently on December 2nd, and this is, again, our local area, we are at a 22.3% positivity rate. And I know anybody watching the news or paying attention to what is happening, this is not just Dover-Sherborn. This is our region. This is our state. This is happening nationally in many of our states. CDC has transmission ranges that they look at: a low range, a moderate, a substantial, and a high range. We will continue to monitor also any in-school transmission to keep our community safe. And we should maintain our low positivity rate and be between the low and moderate range of transmission for a sustained period of time before safe unmasking. And before I open it up and ask the members of, again, our Health and Hygiene Advisory or Boards of Health to jump into this discussion, it is something that at the high school, and I am very hopeful that we're going to be able to do this. We're probably 4 to 6 weeks out. Please do not hold me to that right now. But that being said, it is going to be, and I don't want to call it a roller coaster ride, but we have to be prepared that if we see spikes in transmission in our community, that we are ready to pivot and safely mask again respectfully. So I'm going to ask the doctors to please join me to talk about the metrics and the factors that we will be using.
Perfect. I'm happy to start that if that's okay with the chair. Perfect. So I would say I think there's a slight transposition in the data, which is totally natural because it is confusing data. So I think the number that we're talking about for the case rate is one that should be familiar to the members of the school committees as part of the weekly update that you guys get every week. And that case rate is defined as combining Dover and Sherborn as though it were a single aggregate community, given that that's the school community that we're making choices about, and then treating the difference in case totals as reported by the state in their weekly dashboard at 2 instances is 2 weeks apart, that the difference between that case rate is the number of new cases in the communities. There is some limitation with that data since we can have numbers go up or down when individual people are reassigned from Dover to, oh, actually this person now lives in a different city or town, but their listed address is outdated, for example. So for the purposes of the CDC criteria, the 4 levels are correct. The current recommendation for the CDC is that for people in the substantial and high thresholds, which is that case rate of 7 per 100,000 per day, would recommend universal masking. So that was the operational metric that was in place at the time of the November meeting. It's certainly possible that that kind of threshold could change, though it's been static for a while. So I think it's a reasonable marker, but I think the guiding principle is to say we should look to the CDC about what's prudent. I think one of the pieces that was really clear from families and really thoughtful people from across opinions about masking was how difficult the change in the school year was, as people had one expectation for what they hoped school would look like at the start. And what we needed to do was a little bit different than that, or very different than that, depending on your point of view. And so I think our goal is to try to be transparent about what we'd recommend anchoring around, which I think the federal guidance remains the best strategy to do that. I think one of the other pieces that's important to talk about, and then we talked about with Superintendent Smith, is right now we have, if we sort of look at like what's the key that unlocks a maskless future for us, we're using vaccination. And that's based on assumptions about vaccines being highly effective. And it's based on the risk of really negative clinical outcomes in young people being relatively low as compared to people in their 70s or 80s, for example. And so if we find that variants behave very differently, that's an example of something that could change, where if we say, boy, for Delta, we were 80 or 90% effective, and for Omicron, we're 60% effective, the amount of community protection we're getting from a given threshold of vaccination is really different about how much resilience does that have and how high is the risk of in-school transmission. So I think those are some of the caveats that if we had a crystal ball that was highly reliable, I would both let you know how the Super Bowl turns out, and we'd sort of have really clearly defined thresholds to say, hey, we're going to get here. I think for us, we really tried to stay grounded on like what you can have one most important thing. What is it? I think the first most important thing is safe school. And the second most important thing, which is a close second, is in-person school. And so trying to balance those tensions as we deal with that uncertainty and ambiguity is part of what we're trying to do. But I think the positions from the joint boards were defining that pathway forward as we saw it on the November 10th meeting to say, we think this is kind of the transmission milestone that's reasonable to then let you guys figure out how that makes sense for the district. With that, I'll sort of pause and let Matt, Kara, Lexi weigh in as they see fit, if that's okay.
I think that was well summarized, Matt. I think the one sort of clarification from the slide, because it is easy to sort of mix the terms, is that if we have a threshold of an average 7 cases per 100,000 daily rate, we're currently over 20. So we're I think at the moment in excess of that. And so I think that's what's sort of guiding our current decision making. I don't think it prevents planning for going forward, because we certainly hope that comes down in the coming weeks, particularly as we get more of our youngest students vaccinated. But I think that just to sort of put in perspective where we are, we're sort of well above the threshold at which the CDC would recommend universal masking right now.
And I would add that we're seeing case rates rise every week right now. People are coming inside. We have holidays, and that increased social activity indoors both explains the rise that we've been seeing to some extent, and makes us concerned about further increases until we get through the coming holidays.
Great. Thank you, Kate. Thanks, everyone. Kathy, can we take questions or comments from the committees, or do you have more?
I do have a little more, but I know that we have the health and advisory. They've been on for a while. So if they have questions with our health teams, please ask them now. I do have a couple of other things I'd like to address in this.
Okay, great. So we can do that. Great. I see Jeff and Mark.
Thank you. And thanks all for everybody on the Board of Health. Appreciate that input. I just had a question as it relates to how the high school has been handling close contact, the definition of that. Now, as the elementary school is going to start to have fully vaccinated children, like does everybody still get contacted, or once you're vaccinated, is that irrelevant? How has the high school been handling that?
I can address it.
You want me to handle that, Kathy?
I'd rather the medical team. I can talk about the high school. If a student is vaccinated, they're not considered, or staff, they're not considered a close contact.
But they are communicated with that. So John, do you want to take that, or do you?
Yeah, so what we would do in this case, Jeff, is we would contact anybody that we, considered to be in close contact through our nurse's office. We would communicate that information. And obviously, if they are vaccinated, they can have a stay and continue to test. We would recommend that they test. And that's how we've been handling it. And it's actually gone really smoothly. And we've only had, I think, a total of 3 cases going back into August. And we haven't, knock on wood, we haven't had anything recently.
But just to clarify, if you're vaccinated, you don't need to test. You're just told that you are a close contact.
You are a close contact, and you wouldn't need to test unless you had symptoms. And then obviously, then you would go ahead and get tested. But otherwise, you do not need to. That's correct.
Okay, and from the medical team's perspective, I get alerts now of more and more breakthrough cases as that becomes more of a potential threat out there. Would that change the thoughts on continuing to test even if people are vaccinated?
I think it all is it okay if I tackle that? I think it all kind of remains a work in progress. I think one of the things that we know in general is
for being here as well, and everything he does to make things run smoothly for the music department. Also, I'd just like to thank Mrs. Tomlinson. I don't know if she's still here. I don't think she's still here. For
Perfect. In terms of, I think it's all a work in progress. I think what we know right now is that for general vaccination, there's some waning in effectiveness over time, and that's kind of the impetus behind the booster efforts that have been discussed. I think it's certainly possible that with Omicron, we'll see that the importance of boosters increases. I think that the likelihood of breakthrough infection is part of the rationale behind how testing is offered. I think right now we're adhering to the state guidance about how we're handling close contacts and how it's happening in school is sort of based on those pieces of guidance, partly because my understanding is sort of the infrastructure and supply chain for the test and stay program, for example, is coming through the state. And so we may say we want a super broad testing strategy, and the state may say you can have this testing strategy. So there's a little bit of a balance. I do think that if we see an environment where breakthrough infections substantially rise, there could be a role for that. I think one of the other important parts to say about breakthrough infections is that, again, it can be subtle and counterintuitive, but in a place where we're really heavily vaccinated, you may have lots of your cases be cases in people who are vaccinated, and you would have had a much, much higher number in an unvaccinated community. But if you say 95 out of 100 people are vaccinated and you've got a 5-fold protection, you may still have vaccinated people more present than unvaccinated people because there are 20 times as many vaccinated people in that sample. And so I think that it's not just breakthrough infections, it's sort of breakthrough infections relative to the rate in unvaccinated people that we kind of want to think about, but certainly is one of the things we need to look at over time.
Great, thank you.
Hey, thanks, Matt. So I've Mark, Colleen, Tracy, then Liz, okay?
Thank you. I have two questions about the positivity rate. One, which is on the slide, where it says we're presently at 22.3%. I believe that shouldn't be percent, right? That's 22.3 per 100,000, not per 100.
Correct.
No, we're 2.6% for our test positivity rate, which does not, I actually don't know if the denominator for that includes pooled testing. I suspect it doesn't. And so we are a low rate overall and have been throughout.
Thank you. The other one is with positivity rate, is it increasing also because people can take tests at home, and if they're negative, they don't bother going in to get a recorded test?
Yep.
So the denominator would decrease basically?
Exactly. So if people say, I've got Binax now at home, we tested, we're negative, we're now not going to go to urgent care to get a PCR, then that would not be in the testing denominator. When you look at the testing rate for Dover and Sherborn over the last 6 or 8 months, it's been relatively steady. So I don't think we're seeing that effect yet, but I think it's something we'll see over time. That would change our test positivity rate, but wouldn't necessarily change our total case rate.
Yeah, thank you.
And if I can just add to that, that's part of why I think, we're hinging some of this guidance on case rates rather than test positivity rate, because we feel like that's been much more reflective of the sort of current condition in our community since this all started.
Thank you.
But another little twist is that there are now people who are not following up their positive home tests with PCRs. So there may be some distortion of the numerator as well. So it's hard to know what the real positivity rate is. But
thank you so much.
Thank you. Colleen?
Thank you. In terms of setting expectations, I'm curious how we're defining a sustained period of time of having the low positivity rate and the low to moderate range of transmission.
Right now, we've defined it as 2 consecutive data points, which would span 3 weeks of data in terms of the Board of Health guidance.
Thank you.
Thank you. Tracy?
Yes. So thank you, Mark, for asking that question, because I was going to ask the same one. So we were sent the totals that there were 7 cases at Chickering, 1 at Pine Hill, none at the middle school and none at the high school. Is that still true? And are there other positive cases in the community that we're basing some of these decisions on?
So Tracy, you're referencing what was sent out on Friday. So that was as of Friday at 12 p.m.
Yeah.
So there have been additional cases. I don't have those exact numbers to give you this evening.
Okay, because like I said, the 22% confused me a little bit, so I assume there was other cases somewhere. I'm just not sure. Are we also considering? I don't know the answer to this. Are we considering community cases as far as masking the children in the high school? Is that going to be taken?
So yes, the rates we're calculating is based on the state reported community data, not just the high school data. So yes, there were additional cases in the community beyond those reported in the school.
Okay, so those will keep the children possibly masked because it's a community thing. That's what we're going to go by.
Yes.
Okay. Second question, just a quick one. And I'm not sure if this is something for you all on the Board of Health, but keeping the children who are not vaccinated masked, is that a state rule or is that a local rule?
State.
Okay, thank you.
Great, thanks, Tracy. Liz?
Just to clarify off of Tracy, before I ask my question, I assume we look at the whole community because let's say in my household, my parents live with us and they don't go to the Chickering school, but my kids do. So if they tested positive, that's why we look at the whole community spread, right?
I think that's true. And then the other thing I would say for the majority of the cases, like the vast majority of the cases we've seen in school have been household transmission. And so I do think considering the community data with the data we have available is the most reasonable strategy.
Okay. And then the second question I have, I work in a school in Boston and we received an email today to be very prudent of how we are using our rapid tests because of a supply chain issue that is starting to form. Are we experiencing that out here or do we have, access to the supply we need to keep our test and stay program going and our regular pool testing?
Do you want me to, Kathy? At the moment, our supply is just fine. We have had to reorder at one point for some of the pool testing supplies, but we are good as of right now and for the foreseeable future.
Thanks.
I will also say we have to use it for the populations it applies to. There have been times we've been asked to use it for different reasons. And again, the state is very careful that if we do test and stay, it's for the students that, would be considered qualified for a test and stay. So we are being prudent in that way, Liz.
Thank you.
Great, thanks, Liz. Anyone else have a question? Comment? No? All right, back to you, Superintendent Smith.
Okay, so let me.
I'm sorry. I'm sorry. I just saw Sarah's hand go up. I apologize. Sarah.
Sorry, May. I think just to state the obvious, I think we all want to arrive at the point where it is safe to discontinue masks, not only for our high school students, but for all of our students. But I would be remiss if I didn't express my concern over the rising levels of cases among our elementary students in particular. I wonder if our colleagues at the Board of Health, can speak to that fact that we're, experiencing live, current time right now. It's very much an emerging situation. And I also wanted to ask sort of a logistical question on top of that, which is that we may not be at a point where we're arriving at a final destination, right? These statistics are ebbing and flowing. And so let's say that the case rates drop, that we get to the point where we are at CDC low to moderate for some period of a 3-week period, it sounds like is what the boards of health are recommending, but then they advance again. How do the schools sort of do this dance of, well, we're unmasked this week, we're masked the next week? I'm wondering if you can sort of speak to, the changes that we might be able to foresee living through and working with while we hopefully get to a place of much lower sustained transmission in our communities, but realizing that there may be volatility on the way. So first question, maybe you can comment on the elementary case increases and what, if anything, we attribute that to. And second, how do we manage this ebb and flow?
Oh, go ahead, Alexi, fire away.
So I can start with the elementary. And what we're seeing is reflective of what's happening nationally, state, regionally, and locally. And the virus transmits more among those who are unvaccinated, being indoors with other parties can lead to transmission. And so what we're seeing is increased transmission among the unvaccinated population as they begin to socialize more, happening all across the country, including us locally here.
And so going back to that case rate, so the state also releases age-specific data. So for context, where we sort of talked about Sherborn was at 23, or Dover-Sherborn was at 23 for the last week's report. Ages 5 to 11 at the state level was at 74, which is about twice the state average and about 3 to 4 times the rate of older adults. And that kind of break point started in kind of September, October. I don't know that it's specifically related to school. It may be the changing weather or other social behaviors. But really clearly right now, the two highest age brackets that are substantially higher than the kind of at the state level are that they've got it broken out as 5 to 9 and 10 to 14 are dramatically higher than all other age groups. And I think that's part of what we're seeing here. I think for the kind of second question of like, when do we decide we need to do something different? Or how do we do it? I think I'll kind of give an answer now with a big grain of salt that this is today's plan. And I think just the same way it was a struggle at the start of the school year when it was different than what people expected at the end of the last one, like this is not written in stone. I think that we are likely to be less attached to a specific community threshold. So if we say we got to a good sustained period where we're at 7 and we took off masks, I don't know that that means that when we get to 15, that we need to put them back on to be safe and prudent. I think it's more likely what we would then see is to say, we will enter a more episodic phase where we see COVID waxing and waning or specific patterns. So if we consider a local uptick, or we've got a particular school that seems to be acting differently than the rest of the district, those might be strategies that you say, how can we pull a layer back in right now to say, boy, if the third grade at Pine Hill, we've gotten 3 cases and we don't know why, that might be a reason to say we need to introduce masking, because if our goal is to keep kids in, the thing that will most disrupt that is uncontrolled transmission. How can we reduce that risk? Or, we sort of have had other socially mediated outbreaks in the communities that are sort of, there's X, Y, or Z extracurricular exposure, but that it affects a lot of kids in a particular school or a particular social group. That might be another time that if we're seeing spread based on the contact tracing, either the public health nurse for the community or the school nurses for the district, that will say we just need to do something to try to get the system a little bit more resilient right now. So I think the hope is that in the long term, what we would see is like, what I would hope for is to be able to say we took the masks off and we kept them off, which I think is the things that'll be easiest for our kids. I think that if we do need to put masks on, my hope is that it will be in a time-limited incident-based strategy that we can say, right now we have a Pine Hill issue, or right now we have a middle school issue. Masking is one of the strategies we're kind of putting on. We still take our shoes off at the airport. I'm not sure that that's making me safer anymore. So how do we kind of find that balance? I don't know, Matt or Kay, if you have anything else to add.
Maybe I just have one quick point. I think, as I think about sort of waiting for a sustained period of low transmission before unmasking, I feel like it is a way to set us up for the most success. My worry is that if we unmask in the presence of high community spread and then we start seeing cases within school and we have to put masks back on, it's going to be harder than to take them off the second time. And so I want to sort of get us to a place where it feels like we'll have the most success. And then we'll have direct data to say, okay, we've been unmasked in the school for this amount of time. Here's what we're seeing happen. And then I think it puts us in a better position to respond to changes in the wider community.
Great. Thank
I
you.
mean, I may add that it also gives our elementary population that much more time to become fully vaccinated. There are many kids that are on the way, but the earliest that any of the children in the 5 to 11 age range can become fully vaccinated, and obviously they are younger sibs of the students in the high school in many cases, is essentially next week. So, that's for those who were first in line. And there are many kids that weren't able to get those early appointments. So I do appreciate that there is some additional time built in to allow our youngest learners to become fully vaccinated. I guess the only other question I would ask of our Board of Health folks, I'm putting my policy hat on now as a school committee member and thinking, so how do we craft language that gives the flexibility that's being, asked for, and I think wisely so in this instance. It sounds like not only looking at the vaccination rates in the schools, but also looking at the CDC community transmission makes a lot of sense. But do you have any other sage wisdom for us in terms of how to craft this that gives the type of flexibility that we seem to need here?
We put the word substantial in a lot because it let us hedge our bets. Because I think it's really hard to have a very specific, concrete piece, because you could say, we're really good right now. And if the early data out of South Africa is like Omicron's a nightmare, which it doesn't seem to be yet, but you don't want to be too locked in, because then people really feel you said this would happen and it didn't. And so I think that my advice would be, I think this is truly ambiguous. And so I think owning that ambiguity to the degree possible, and not being overly rigid about this is a specific numeric threshold makes sense. I do think it makes sense to plan and to say, we want to be ready when we hit this milestone, because it's clear that it's important to our kids in our community when we can do it safely to do it. But I do think, I think we see part of our job as helping be a gatepost along the road where we said, giving that long lead time, this is reasonable. We continue to work really closely with the district about what are the specific things we're seeing in school, what's the data telling us, how do we make the best choices we can. And I don't think that'll stop with the policy. And if something changes dramatically where it's like, this was a really good idea with what we knew in December and it's a terrible idea with what we know in January, part of our job is to help bring that to the table and to talk to the district and talk to you guys.
Thanks, Matt. Thanks, Sarah. Maggie?
Thank you, Nancy. I guess my question is along the lines of Sarah's in terms of the policy, and also just a question for the Health and Hygiene Committee or school administration. My contacts in Hopkinton and now I think Westboro, which have taken advantage of, an opportunity for flexible masking, have spent a lot of time addressing the needs of both faculty members and students who have immunocompromised situations that make it challenging for them to be in large public spaces unmasked. And so, in both of those communities, there are provisions in place for, the students are said, you have to always have a mask with you because you might be in a classroom and we may or may not be able to give you the details where there is a student or a faculty member who requires that extra protection for their health and safety. Have we been giving any thought to, because we keep talking about unmasking, and in those communities which are trying it, they're talking about flexible masking or, being mask friendly or, different kinds of euphemisms. Have we been having those conversations? And if so, how will we address those concerns when we are able to be more flexible with the masking?
So let me start to answer that, Maggie. So I've been in constant contact with Principal John Smith and his team. We've already begun conversations, with our students. We wanted to be very careful not to get hopes so high, but I recently had, as a matter of fact, last evening, with our co-presidents of our Dover-Sherborn Educators Association. So we are going to have some forums for our teachers and staff to talk about some questions they would like answered. Forums for the parents and the community, coming up with a list of frequently asked questions, working with our students and our staff for the very things that you just said, being inclusive, being respectful. One of the things coming out of Hopkinton that I'm hearing is when they initially started this, I believe it was November 1st, even though they had a very high vaccination rate of students and faculty, maybe 60% were unmasking. So it wasn't that everybody that was vaccinated right away was unmasking. And it obviously made it a little bit easier rather than the so-called finger pointing. So I assure you that's the next step. Right when we were starting to do that, coming up with a communication plan, we were dealing with obviously what you've seen happen, again, not only in Dover and Sherborn, but in the surrounding communities. So very much on our front burner, and we will have a plan that I will be able to share with you probably within a week.
Thank you so much, Superintendent.
Okay, great. Thanks, Maggie. Back to you, Superintendent Smith.
Again, I continue to thank our health advisory. We meet every week, and when I look at, it's a solid hour. If it has to run over, a lot of discussion and how we, again, the goal of keeping our students and staff in school safe and moving forward. Next slide, please. Before I actually go through these rates with you, I do want to talk about a couple of things, and I'm reaching out to the parents in the community along with obviously our school committee. I do want to ask people, please do not let your guard down right now. The pandemic is not over. We are finding that many of the cases that we're seeing and we're reporting are due to household transmissions. And the reason I'm sharing this guidance is we need the support of our entire community to keep our students in school again for in-person learning. If your child is unvaccinated, and Sarah makes a good point that our younger students, you're going to be pleased when you see the numbers of our students, moving towards full vaccination. But if your child is unvaccinated and has been exposed to a COVID positive individual, please do not send your child to school. They are considered a close contact and need to be quarantined. Your child's school nurse will be happy to provide details on quarantine protocols. Please continue to review the symptom checklist daily. If your child is demonstrating signs of illness, please keep your child home and then follow up with the school nurse regarding next steps. If there is a positive COVID-19 case in your household, please answer the call from the public health nurses for contact tracing purposes and guidelines related to quarantine and isolation. If a close contact in school can utilize the test and stay, this is a signed option. Please sign on if you haven't done so already. Close contacts outside of school, unfortunately, do not trigger the test and stay option. And that is not our determination. That is the determination of being able to use the test and stay program for, again, the close contacts in school. Be careful with play dates. Be careful with unmasking outside of your household. And please, again, send your child to school each day with 2 masks, especially our little ones. It's very helpful, although we do have some masks. We've taken advantage of the Department of Elementary and Secondary Education, had opportunities for us to go and get some masks and some of the materials and supplies we have used for mitigation. But it would be helpful if the kids come to school with that additional mask each day. And let me quickly go through these vaccination rates. And again, even though I'm reporting them this evening, these were prepared Friday, and I will try to update them on the go. So as you can see here, I am looking at our 6th grade, and I think all of you know that we do have a clinic coming up on December 16th in conjunction with the Mass Department of Public Health and Fallon Ambulance Service. It is going to be at Lindquist Commons, I believe, from 4 to 8 p.m. We do have a link out there for pre-registration, but I particularly want you to look at our 6th grade. If parents, I'm told many times our students are going from every day, they're going from 11 to 12 years old. If parents are waiting to get that larger dose, I know words from the medical community, your pediatricians are telling you that when you're able to get them vaccinated, if they're 11 years old in December, get them vaccinated now. So we're hoping to see that number come up. And you can see where the middle school staff stands, 90% 8th grade, we're very pleased. So next slide, please. Very quickly, not much has changed at the high school, although your 12th grade is up to 90%. And again, your overall rate has hit 90% at our high school, hence the discussion on the unmasking. And next slide. So we're excited again for our 5 to 11-year-olds. And I know this figure has changed. So what I do know today is we have 117 at Chickering that are fully vaccinated. Interesting enough, at Pine Hill, we also have 117 that are fully vaccinated. We have, I believe, 191 at Chickering that have had their first dose, and 157 at Pine Hill that have had at least their first dose. So all told, we're getting close to 60% are at our students in grades K through 5 at our elementary school. Again, please take advantage. I know many parents, and in speaking with our health advisory, you have the local pharmacy chains that are offering vaccinations. I've seen young students, when I look at the news, standing in line for up to 45 minutes with their parents. You have pediatricians' offices that do have some of the vaccine, but I don't believe enough to go around. So please take advantage of what is being offered here in your own district. And I do have to say to parents, we are getting phone calls or questions about boosters for our older students who were probably vaccinated back last May and June. We do not have the boosters available, but we do have the vaccines for 5 to 11-year-olds and our 11 to 18-year-olds. So again, please take advantage of this opportunity. Next slide is all about, again, the clinic coming up. You'll see the second dose is on there for January 6th. Again, in Linquist Commons, no fee, but pre-registration is required. And you have, again, and of course, they have to have the permission of their parents, obviously. And any questions, you have a contact there. And next slide. I thought I had a slide on the additional nursing position, or there we are. You did hear that we are so pleased that we had the opportunity to hire an additional nurse with a long-term substitute nurse position. This nurse was hired appropriately on November 10th. We put her to work right away. It's fulfilling multiple needs across the district. It's supporting our Dover-Sherborn school nurses and managing our school health programs, coverage across the districts for absences, screening needs, coverage at Pine Hill to alleviate our nurse leader, Jill Fedor, who is needed all over the district when we're dealing with, again, some of the positive cases, the close contacts, the calling of parents, the test and stay, the pool testing, all of the things that we're doing, again, throughout the district, and the COVID-19 testing program support in our schools. So that, again, is my report, Madam Chair, and I am going to recommend that the face covering policy go back to our policy subcommittee for modification and review.
Okay, all right, great. Thank you so much, Superintendent Smith. We all had in our packet, Beth, you're not doing a presentation on the, okay, right. We all had in our packet for the second read of the Dover-Sherborn Educators Evaluation, the reform and evaluation. So can I have a motion to adopt? We have to do this by committee. So, but before we even go into committee, can we have, does anyone have any questions or comments on the second read?
May I just make a clarifying point? I just want to make sure that the members are aware that most of the changes that are proposed are going to be seen in the handbook, the Supervision and Evaluation Handbook. The only actual change to the DSEA contract is a date change in that formerly we had until June 1st to notify a non-professional status teacher that they will not be invited back. We are moving that date back to May 15th, just to give educators an opportunity to find other plans if necessary. So the DSEA has voted to approve the changes to the handbook and the contract. So hence we're coming to you tonight.
Great, thank you for the clarification. Questions or comments? Okay, I will start at the region then with Kate. Kate, you want to ask your committee for a motion to adopt the Dover-Sherborn Educators Evaluation evaluation.
Okay, thank you. I would like to invite the regional school committee to adopt the MOU evaluation. I'm missing something in there, Nancy.
Invite a motion. You say you're missing something?
The Dover-Sherborn educators evaluation, is that, I had that from our last meeting, notes in my last meeting. That's how I referred to it, different than on the agenda or how I was told to refer to it. So, so the Dover-Sherborn educators evaluation, I guess, MOU.
Okay, thank you.
Beth, is that good? Yes. Okay. So, Kate, you're asking for a motion to adopt the Dover-Sherborn educators evaluation MOU.
Thank you. I would like to invite a motion to accept the Dover-Sherborn educator evaluation MOU.
So
Collins.
moved, Judy Miller. Oh,
Lynn
yeah.
Collins, second.
Thank you. Any further discussion? Okay. Maggie Sharon.
Maggie Sharon, yes.
Judy Miller.
Judy Miller, yes.
Angie Johnson.
Angie Johnson, yes.
Tracy Mannion.
Tracy Mannion, yes.
Lynn Collins.
Collins, yes.
And Kate Potter, yes. Thank you.
Great. Thanks, Kate. And over to Dover. Sarah, would you like me to read again or do you have it?
I've got it. Thank you, Nancy. Is there a motion from the Dover School Committee to adopt the Dover-Sherborn Educators Evaluation MOU?
Mark Healy, so moved.
Thanks, Mark. Is there a second?
Colleen Burt, second.
Thanks, Colleen. Any discussion? All right, for a roll call vote, Colleen?
Colleen Burt, yes.
Liz?
Liz Grossman, yes.
Mark?
Mark Healy, yes.
Jeff?
Jeff Cassidy, yes.
And Sarah Gutierrez Dunn, yes.
Great. Thanks so much, Sarah. Can I have, for the Sherborn School Committee, can I have a motion to adopt the Dover-Sherborn Educators Evaluation MOU?
Amanda Brown, so moved.
David Kazis, second.
Thank you. Any discussion? Okay, for a roll call, Amanda Brown.
Amanda Brown, yes.
David,
David Kazis, yes.
Dennis,
Dennis Quant, yes.
Gita,
Sangita Russo, yes.
and Nancy Cordell, yes. Okay, great. Thanks, everyone. All right, I am now going to turn it over to Judy Miller for the superintendent search update. It's all yours, Judy. You're on mute.
Yeah, I know. I was fumbling with my buttons. Give me 1 second and I'll be all set. All right, good. I am pleased to report on the activities of the Dover-Sherborn School District Superintendent Search Screening Committee. First, I want to thank my fabulous co-chair, Colleen Burt, who is on the Dover School Committee and has been a wonderful partner in making this process smooth and effective. As you know, the screening committee was made up of representatives of each of the stakeholder groups at DS, administrators/leadership team, educators, parents, and school committee members. We had a committee of 16 people, and despite its size, we functioned collaboratively, efficiently, and with humor and with some joy. On behalf of the 3 school committees, we would like to thank the members of the screening committee profusely for the many hours they devoted to reviewing applications, interviewing candidates, and deliberating during the preliminary selection process or the preliminary screening process. The conversations were lively, insightful, and courteous. It was a pleasure to work with this group of truly dedicated people. I would like to specifically recognize and thank each of our members from the administration team and David Keegan, Kate McCarthy, Dr. Barbara Brown, and Monique Marshall-Veal. Parents Fiona Hugh, Jennifer Debin, Anne Marie DeBarros Miller, and a special shout out to Lori Crisell, former RSC member, who was the secretary of the committee and kept all of our minutes. Educators Lainey Glenn, Carrie Dardumpre, Heidi Lawando, and Carly Eccles. And school committee members Tracy Mannion from the region, Nancy Cordell from Sherborn, and last but not least, my friend Colleen Burt from Dover. Over a period of 3 weeks this November, the screening committee met on several occasions to review applications and interview candidates for the position of superintendent of schools. We enjoyed our conversations with applicants who represented a wide range of experiences and backgrounds. We thank all those who expressed an interest in becoming our next superintendent. The screening committee met in executive session and reviewed all the completed applications and subsequently selected a number of candidates who were invited to meet with the screening committee for a preliminary interview. Following the preliminary interviews and after much in-depth discussion and consideration, the screening committee, during its meeting on November 22nd, 2021, voted to recommend 3 candidates for consideration by the Dover-Sherborn school committees. Drum roll, please. No, just kidding. The 3 candidates listed in alphabetical order are Gerardo Martinez, currently a principal in the Wellesley Public Schools, Dr. Joseph Maruzak, currently co-founder and superintendent of Nuestro Mundo Public Charter School and former superintendent of Mendon-Upton Regional School District, and Elizabeth McCoy, currently assistant superintendent for the Dover-Sherborn Regional Public School District. We look forward to working together with members of our community as the superintendent selection process proceeds. Now, we would like the committees to vote to accept the slate of candidates. The purpose of this vote is to simply affirm that the committees would like to move forward with the selection process and interview these 3 candidates. I want to remind the members of each of the school committees that the screening committee operates in executive session so that candidates who apply can feel safe and assured that their identities will not be revealed publicly. Therefore, this is not a time to ask questions about how the screening committee made its determination. Further, if you have questions about the process going forward, as I'm sure you do, we will discuss and answer all of those questions and set out the process in detail for moving forward during our workshop meeting this Thursday, December 9th. So I also would request that you hold those questions to discuss them for that meeting. So, Nancy, can I ask you to ask each committee for a motion to accept the slate of candidates for the purpose of considering each of them for the position of superintendent of the Dover-Sherborn Regional School District?
Sure. I will start with the region. I will start with Kate.
Thank you, Judy. I didn't write that all down fast enough. But the motion is to accept the slate for the Dover-Sherborn superintendent as stated. Is that acceptable, or would you like?
Yes. I think it is. Hold on one second, and I can read it to you. A motion to accept the slate of candidates for the purpose of considering each of them for the position of superintendent of the Dover-Sherborn Regional School District. And you can just say what she said. Or maybe I could say so moved.
Thank you. Do I have a second?
And Collins second.
Thank you, Lynn. All right, we'll take a roll call vote. Maggie Sharon?
Discussion?
Oh,
Discussion?
Thank you.
It's okay.
Oh, am I frozen? No. No discussion. Thank you. Maggie Sharon?
Maggie's frozen.
Some people are frozen. I think Dover's frozen. Let's see. Angie Johnson.
Angie Johnson, yes.
Tracy Mannion.
Tracy Mannion, yes.
Lynn Collins.
Lynn Collins, yes.
Judy Miller.
Judy Miller, yes.
All right. And did Maggie disappear? She did.
She's reconnecting. There she is.
Sorry, I got kicked off the Zoom. I don't know why. I vote yes.
Thank you. You were next, and Kate Potter, yes. Thank you very much, Judy and team. This is an unbelievable amount of work, and I can't tell you how much I appreciate your time and energy.
Okay, but I have the Dover go next. Sorry.
Sure. Sure, thank you. Is there a motion from the Dover School Committee to accept the slate as stated for the purpose of considering these individuals for the position of superintendent?
Liz Grossman, so moved.
Second?
Jeff Cassidy, second.
Any discussion?
Can I just ask a clarifying question? Were there 3 candidates or 4 candidates? I thought I heard 4. 3. Okay, thanks.
3. There are 3 candidates. I hope I didn't misspeak and say 4.
I heard 3. All right, so let's, any other questions or discussion? We'll go on to the vote then. Colleen?
Colleen Burt, yes.
Jeff?
Jeff Cassidy, yes.
Liz?
Liz Grossman, yes.
Mark?
Mark Healy, yes.
And Sarah Gutierrez Dunn, yes. And again, a thank you to the screening committee and to the members of the search team for getting us to this exciting place.
Okay, great. Sherborn School Committee. Can I have a motion to accept the slate of candidates for consideration for superintendent?
Amanda
David,
Brown, so moved. Oh, sorry.
Go ahead.
Amanda Brown, so moved.
Davy K is a second.
Okay, great. Any discussion? Okay. Gita,
Sangeeta Russo, yes.
Amanda,
Amanda Brown, yes.
David,
Davy Kazis, yes.
and Nancy Cordell, yes. And I would like to say, everyone that we worked with, thank you. But to our fearless leaders, Judy and Colleen, they really, they gave us the protocols. They gave us the leadership and guidance. They make sure we're well fed and well hydrated and work with everyone's schedule. So thank you so much, because that was a lot of work just to get our group together and, pointed in the right direction. And so I thank you both so much for all the time that you spent doing that. It was a great experience. It really was.
Thank you. I don't want to speak for Colleen, but it was certainly my pleasure, and I'm sure it was hers too.
Yes, it was. I will unmute. And we appreciated a home cooked meal by Judy Miller, I have to say. She has some really amazing skills feeding that many people. So I think her experience in the DS theater scene taught her to feed large amounts of people. We're very appreciative. But thank you to all the hard work from the members of the committee. It was a lot of time and energy, and I think a really effective group. So it's a great experience for me too. Thank you.
Yeah, and a very collegial and positive experience, I thought, which was wonderful. And now I'll stop talking.
Sarah?
So again, thank you. And Judy, that's really going above and beyond, adding catering to the package there. So just to ask a quick question, and maybe this is more fodder for Thursday's workshop discussion, but would you care to say anything about our timeline at this meeting?
I'd be happy to. The timeline really is dependent. We're going to set it at this meeting on Thursday. as I see it, we will start by interviewing the 3 candidates as a group, and then we will decide, we will ask them back to visit the district, them, some or all of them back to visit the district, and then we'll deliberate shortly after that. And I would love to get the process completed by the end of January. I don't see the visits occurring until January, given that it's almost, the holidays. So does that help?
That does.
Okay.
All right, great. Thank you so much. Exciting. All right, moving on to the consent agenda, where we did have minutes from 2020 in there. Right? That was correct. Okay. So by committee, and I'll just go in the same order. I'll start with Kate in the region again. If you can make a motion to approve the consent agenda.
Thank you. I would like to invite a motion from the region to approve the consent agenda.
Just a question, Kate. I'm so sorry. I wasn't here for some of these meetings, so should I recuse myself?
That is a good question. I don't know the protocol for that.
Judy, I was only here for 2 out of about 8 of those meetings. So, and I think there's other new people here too that were not at those meetings.
I don't know.
I don't either.
I don't either, but I'm wondering if they should abstain. I don't know.
Yeah, I'll do that. That's fine. That makes it easy.
Yeah. You don't have to, but it makes the most sense. But I don't think there's a rule that says you have to.
Okay, thank you.
Thank you, Tracy, for pointing that out.
Thanks.
Okay, so from the region then, a roll call vote.
I think we have to do the motions and stuff.
Oh, sorry, I had made the motion. Okay, I would like to invite a motion from the region to approve the consent agenda.
Maggie Sharon, so moved.
Colin, second.
Thank you. Any further discussion? Okay, we'll take a roll call vote then. Judy Miller.
Judy Miller, yes.
Angie Johnson.
Angie Johnson, yes.
Tracy Mannion.
Tracy Mannion, abstain.
Lynn Collins.
Lynn Collins, yes.
Maggie Sharon.
Maggie Sharon, yes.
And Kate Potter, yes. Thank you.
Thanks, Kate. Over to Sarah.
All right. Is there a motion from the Dover School Committee to approve the consent agenda?
Colleen Burt, so moved.
Second?
Mark Healy, second.
Any discussion?
My brain's sort of a jumble these days, but I'm pretty sure I wasn't here for the 2020 ones either. So I'm going to abstain as well.
Okay, we'll go through the roll call, but that's
Okay.
completely fine. All right, so Colleen?
Colleen Burt, yes.
Jeff?
Jeff Cassidy abstained.
Liz?
Liz Grossman, abstain.
Mark?
Mark Healy, yes.
Sarah Gutierrez Dunn, yes.
Okay, great. Thank you. Okay, Sherburne.
Nancy. Oh, I'm sorry. I need to just add one thing after you're done with this.
Yep, no problem. Sherburne School Committee, can I have a motion to approve the consent agenda?
So moved, David Kazis.
Do I have a second?
Second by Sangeeta Rousseau.
Okay. Now, roll call. I'm going to call on Amanda first.
Amanda Brown, yes.
David.
David Kazis, yes.
Gita.
Sangeeta Rousseau abstained.
Okay, and Nancy Cordell, yes. All right, great. All right, so Judy, go back to you.
Yeah, I just wanted to let people know that the resumes of the 3 candidates will be up on the DS website tomorrow, hopefully by around noonish. And that's it.
Okay, great. Thank you. And by unanimous consent, can we vote to adjourn tonight's meeting? Give a thumbs up. All right, great. Thanks, everyone. Thanks so much.